The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all have a nice and positive week so far, and looking forward for a nice and relaxing weekend. This program is broadcasting live from the studios of Inspire FM today on 31st of October 2019. And casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden, Bedford, and our positive waves going all across the listeners who are listening us on Inspire FM web app or website. We're also live on Facebook, so you can view us directly on Facebook. All you have to do is just go to the Inspire FM Facebook page and click live link. If you're listening to the show on Sunday or any other Thursday, that means it's repeat. But hey ho, today is 31st of October 2019. So, as we all know, we do shows and we do different topics every single week. And definitely today's topic is something which is very much in line with the topics which we have done last week and a couple of weeks before, which is flu vaccination. Yes, indeed. So today's topic is about flu vaccination, but we will be talking about the flu vaccination in elderly and pregnant women. So, without further ado, as we all know, I'm not the guy who normally speak about these topics. I always have a lovely guest with me, and today I have a house full. So luckily, it's not always when I have a full house where I have all my guests, all my seats are filled with my lovely guests. So today it's one of those days. So as I said, the topic for today is flu vaccination. Improvement of flu uptake in pregnant women and people who are on high risk groups and elderly. And guests today who are joining me in the studios, starting from my left to right, is Richard Jones from Luton CCG. Good evening.
Good evening, Fahad. Richard Jones. I'm a Luton person, a Luton Town football supporter, but I also work in the health service. And currently my position is in the clinical commissioning group, which probably doesn't mean anything to anyone, but medicines are one of the areas of responsibility for me. So I'm pleased to be here to be able to talk to you and emphasise the importance of having flu jabs.
Okay. Joining me also from Luton CCG is Naisha Henry. Good evening, Naisha.
Hi, good evening. My name's Naisha Henry. I'm the flu lead for Luton CCG, and so that part of that role includes really liaising with our partner organisations and just generally encouraging people to take up the flu vaccine.
Indeed. Also joining me today is Dr Grace from Luton Hospital. Good evening, Doctor.
Good evening, everyone. So I'm Grace Okoye. I'm one of the neonatal consultants. I'll explain what that means. So neonatal is just another branch of pediatrics. So and we deal with very small newborns, preterm babies, also newborns that are critically ill. I work in the neonatal intensive care unit in lovely Luton Hospital, Luton and Dunstable Hospital.
Indeed.
And I'll be hoping to convince all of you why it's very important for the unborn child that moms get vaccinated. Thank you.
And our final guest, last but not least, definitely, Emily from Public Health. Good evening, Emily.
Hi, I'm Emily Chedy. I work at Public Health England. I'm an immunisation coordinator. Public Health England is set up to protect the nation's health and we organise and promote the vaccination programme every year across Hertfordshire, Bedfordshire, Luton and Milton Keynes.
Perfect. So, as I said, it's not always when I have a full house, and luckily I am having a full house today. And it's always nice to have a lovely guest in house and in front of me, rather than on the other side of the phone. So, thank you so much, first of all, for coming in to do this show today. Thank you. Right, so let's start about the show itself. So, as I said earlier, it's all about flu. So let's ask the big elephant question, which is, what is flu? So, as we all know, let's start with you, Richard.
Yeah, and don't confuse. I'm not an elephant, so if I had to, let's ask.
I can relate
I'm as
you
big
with
as an elephant.
I can relate. I can relate myself to being an elephant, but that's different thing.
So flu is a virus that commonly appears in the winter months, but not exclusively to the winter months. It's very infectious. It causes respiratory problems. You would know if you had flu. People say I've got flu when they've got a cold. Flu. I don't know how much detail you want me to give on this, Fahad, but flu has a quick onset of action, whereas colds tend to take a little bit longer. You can feel that little tingling in your nose and that little cough there. Flu will also give you a temperature, a high temperature over 101, whereas colds generally don't give you a high temperature. With flu, you'll get aches and chills, and you can get complications, and that's why it's so important that we immunise. We have the flu jabs, because it's not just the flu; it's the complications that come with having the flu. So I don't know if Naisha or Grace or Emily want to add to that.
Yeah, I think Richard has said most of it, and one of the importance is distinguishing it from the cold, just the common cold and the flu, and you've highlighted the main differences in the early onset, the severity. Most times it's largely uncomplicated, but in very high risk groups, like Richard has mentioned, you can have serious illnesses, and even in very rare cases, death from the flu. So I think this program is focusing, on pregnant women who are one of the high risk groups. So I think it's very relevant that we differentiate that differences and stress that there can be serious outcomes in high risk groups.
Indeed.
Flu, yeah.
And sometimes people, although they know that flu is something which is not a joke and not to be taken lightly, people don't get the flu vaccinations, especially the ones who supposed to have. So in general way, how does it spread? And one of the biggest things which normally comes up is, how do we spread? So Naisha, as you are the flu lead, can you put some light on that?
Well, yeah, flu is, as you know, it's a virus, and germs can be spread by when a person coughs or when a person sneezes. That is what would quickly spread the flu, and especially because those viruses can actually live on hands and surfaces for 24 hours. So really, if someone has a cold or a flu, we want to be conscious of how we can reduce the risk of spreading it.
Indeed.
So, often you need to wash your hands. Wash your hands regularly with warm water and soap. Make sure if you do sneeze into a tissue or cough into a tissue, you throw it away bin it straight away. So those are simple measures really that we can all take to prevent spreading the flu.
What was that? That was that catchy thing. Sneeze it, bin it,
Catch it, bin it.
Yeah, it's not that catchy, but I couldn't remember.
Catch it, bin it.
Catch it. We don't have that anymore. I don't think. I've not heard that for years.
Well,
catch it.
Grace, what happened? Sorry, Emily. Ouch. This is something which I was very proud of myself that I did not mess the names up in the beginning. But unfortunately, I'm done with my curse. So, Dr. Grace, can in terms of spreading, because you see people on a daily basis as a clinician. How can you explain about the spread?
So I think Masha has explained, but in terms of spread, you can have direct transmission. So if someone coughs or sneeze, what happens is that you get particles in the air, and anyone that is around at that time that is exposed to those particles via the eyes, the nose, or the mouth can get the infection. Also, the particles can stay on surfaces, different surfaces, and if you put your hands there as well, and the hands come into contact with any of the eyes, the nose, or the ears, you can you can get the infection. Very importantly is hand hygiene, as Misha has mentioned, and what we do in the intensive care unit, as in not just for the flu, for any infection, is we really stress the importance of washing our hands. It's very, very important. You can be amazed where the virus can be on your steering wheel, on the door handles, on toys, on surfaces. So it's very important that we maintain that hand hygiene.
Indeed. And hygiene is definitely important. But then whenever we talk about flu, we always say the flu season is about to start or the flu season is about to finish. So, Emily, can you put some light on when we say flu season, what do you mean by flu season? And do flu season fly away as well?
So generally we talk about flu season as from sort of September to March time, and that's when we vaccinate. And we start offering vaccinations as soon as we get the vaccines in September. And we know we have a peak around December, January time, so we try to get everybody immunised if we can before Christmas, so that that they're covered as soon as the virus really does hit. And we keep vaccinating through to March. So, for instance, in the case of pregnant women, we encourage pregnant women as soon as they know they're pregnant. From September, we encourage them to go to their GP and request the flu vaccine. And then anyone who becomes pregnant at any point up until the end of March should go to their GP and get vaccinated.
Now, if I'm not mistaken, pregnant women also come under the special group. If I'm not mistaken, Naisha, is that true? The special, the high risk group. Yes.
Yeah, the vulnerable group.
The vulnerable group. So, if you put some light on the vulnerable group, what are the vulnerable group?
So, well, as part of the NHS national program for immunisation, there is a group of patients that are considered to be more at risk of contracting or the complications that come out of having flu. So it's all your immunocompromised patients, all your patients, older patients normally, so over 65s, patients with chronic long-term conditions, for example, chronic respiratory disease, chronic kidney disease, chronic liver disease, diabetes. So all these groups of patients with these long-term conditions, they're just more at risk of suffering the complications of flu. So they come under that at-risk group.
And can I just add?
Please.
So can I just add the pediatric population? So obviously the unborn child it's very important. I think in the criteria for vaccination, less than 6-month-old children are not to be vaccinated, as in there's no vaccinate.
Vaccine,
yeah, we only vaccinate from 6 months and above. So that's why it's again very, very important that pregnant women take the vaccine, because they can protect their unborn child for that first 6 months of life. And also, I think postpartum, so after a woman has had her baby, that 2 weeks after a woman has had her baby, she can still get the vaccine and protect her baby through breastfeeding as well. So it's really important, and that's one of the important things I wanted to stress as well. That first 6 months of life. So giving the baby that protection, because they can't have the vaccine. So this group is very vulnerable, and there's a lot of literature to say that less than the under 2s are where there's higher mortality and morbidity, so higher chances of being very unwell, hospitalized, and then very rarely, though, there have been reported cases of death in children less than 2 years.
I was in a conference in London a few days back, and I must say in that conference it was all about diabetes and flu, but they were talking about the deaths of the flu and a number of deaths which has been decreased just by the introduction of flu vaccination program in last 20 years is significantly from high to low. So previously, according to them, there was like between 12 to 18% death which used to happen previously. Now has reduced down to 2%, 1 to 2% death because of flu, and people don't hear this quite often, but that means we are getting vaccinated in the right group at the right time. Indeed. Let me introduce our listeners.
I think Emily has a
Sorry.
question.
Could I just add to that, actually? We know that our patients with diabetes are very good at coming forward for their flu vaccination, and that's probably reflected in the figures that you've just quoted. But there are a few other risk groups that we would just like to stress, and which we're calling in our area the super at-risk group. So we have our patients with chronic liver disease, our patients with chronic neurological disease, our learning disability patients, and our immunocompromised. And we've added the pregnant women onto that as well, because they really are a group. So all of those groups, we really want to come forward for their flu vaccination. And remember, you can go to your GP or you can go to your local pharmacy for your vaccinations, and also they're being offered in hospital. So if you are offered your vaccination wherever you are, please accept it.
Oh, I did not know it's offered in hospital as well.
Yes,
I attended a learning disabilities conference. I actually spoke there, which
Ouch.
and I told a few of my jokes. But we did talk about the uptake of flu vaccination in people with learning disabilities, and it is very poor. And we're talking about the adjustments that we can make to to understand why that if a patient with learning disabilities is offered the flu vaccine, they decline, and you have to get to make those extra adjustments. And the example I was given was a learning disability adult who had fought in the war, and he was, seeing that needle coming towards him was quite a scary thing. So the nurse said to him, "Look, just pretend that you're in the army and you're having all your jabs, and put your arms like this and sit up like a soldier." And he was okay. So, it's making an extra effort for those some of those very vulnerable groups.
And there is more that we can do in cases such as that. So if we have someone with learning disabilities who is very needle phobic and would refuse an injection, we can actually give the nasal vaccine.
Yes,
so there are other options as well. We just need to be.
Indeed. Wow, I did not know that. I know it shows that regardless of being in the NHS since last 10 years, I do not know half of this stuff. So anyhow, this is time for me to add our listeners to the show. So listeners to the mix. So listeners, If you have any questions or queries regarding our show tonight, please give us a call on 01582 481822. I repeat, 01582 481822. You can send your questions by text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. And we are talking about flu vaccinations for long-term conditions and pregnant women and at-risk group, people on at-risk group. So and we will be highlighting all these necessary things on the show. So moving on. One of the things whenever we talk about flu is the specific flu symptoms. Now, it's really hard to identify a flu symptoms, right? Because most people think that coughing and feeling cold, and Richard has in beginning has highlighted some of the symptoms. So if I ask all of you to highlight one of the symptoms which you guys come across either in person or in your patients or in journal and the surveys.
I think the one of the key differences between flu and a cold is the height, the temperature that patients will experience. So colds generally you don't get a very raised, if any, temperature, but the flu you do. Now I had the misfortune to experience influenza a couple of years ago. Now I was on call actually at that time, which made it pretty inconvenient. And
you had your flu jab?
I hadn't. No, oops, I shouldn't say that. That's a bad message. And well, this is a lesson to me because I've had my flu jab since then. And it's onset of action, whoomp, it just hit me very quickly. Coughing, I couldn't stop coughing. And then my temperature went up. I felt immensely cold. I felt my life actually. I felt vulnerable at that point, and I developed these sort of shakes, rigors, and couldn't get warm. So it's quite an intensive experience, influenza. But that's relating from a personal experience, but also, and there are other. I don't know if you want to, Grace want to talk about.
So talking about the pregnant woman. So if a pregnant woman is not protected from, has not been vaccinated against the flu and gets the flu, like Richard has said, you can have a high temperature, and there have been studies to show that when pregnant women have high temperatures, it can significantly affect the unborn child's development. Even just being unwell with these symptoms can affect the unborn child's development and well-being, can affect their growth inside. These another reason to highlight why pregnant women should be vaccinated and be protected, because they'll be protecting their baby. We do see as a consequence of pregnant women not having their regular vaccine, we do see babies that are very, very underweight, so low birth weight, and also preterm. And it can extend from there on to affect all their organs, because being preterm, your organs are all underdeveloped and immature. So and that's what we see when we admit these preterm babies. So the mother can go on to have a fever, can go on to have a chest infection, and that can be transmitted to the baby in terms of affecting their development quite significantly.
And Naisha, what sort of message you like to give in terms of the symptom-wise of flu?
Yeah, well, I think it's pretty much been said, really. I mean,
have you experienced flu?
I thankfully have not. Wow. So I cannot, unlike Richard, talk from personal experience. But somebody once described it to me as, for example, if you had the cold and you were in bed and you saw £10 in the garden, you'd put on your blankets and you'll go and pick up the £10 off.
Oh, I think okay.
What have you had to?
If you had the cold.
Oh, I had the cold, yeah, but
if you had the flu,
it had to be £50.
Not even that would get you out of bed. So really, the symptoms of flu are really quite intense.
And just to add, when you get some other diseases, because you've had the disease, you it protects your immunity. But with flu, because you have so many different versions of flu, that's why you have to have it yearly. Because even if you've got the flu this year and you had all the symptoms we've described and you feel that you are immune and protected, another strain comes next year. So it's just because people say that quite often. I've got the flu and I'm fine. It's like if you've got chicken pox, then you're immune for life, but it's not the same with the flu. So
and actually you find if someone's had the flu, the real flu, they're more likely to come for vaccination because they know how serious it can be. And just to go back to the pregnant women and flu vaccine, unfortunately we have had cases of pregnant women die because of contracting the flu.
Seriously?
Yes,
Wow.
It really is that serious because your immune system doesn't work quite as well when you're pregnant.
I need to hold you on that because we're just literally going on the break. I did not notice how quick we are. So we will be right back after these short messages.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm your host Fahad Matin for today's show, and today we are talking about flu vaccination for pregnant women and long-term condition patients. With our lovely guest in the studios, Richard Naisha from Luton CCG, Dr. Grace from L&D, and Emily from Public Health. This program is broadcasting live from the studios of Inspire FM today on 31st of October 2019 for our lovely people in Luton and all the people surrounding Luton areas like Dunstable, Harpeth and Bedford. And definitely all the listeners who are listening us online or viewing us on Facebook. Welcome back. And especially good evening. So before we went on break, I have rudely interrupted Emily because she was saying something and I completely interrupted her while she was explaining about the flu vaccination. So Emily, if I ask you to try to start from where I've stopped, which I know it's not easy, but yeah, one of the things which you were mentioning about was the flu vaccination and their contents as well. So when we talk about flu vaccination, what sort of contents which we have to look after?
Okay, so the flu vaccination that we offer to adults is an injection. Goes into the top of the arm. So in there we've got 4 strains of the flu. It's called a quadrivalent, so it's a 4-strained injection. What the one thing I'd just like to say to all of your listeners is that there is no porcine gelatin in the inactivated flu vaccine. And
Means any injections we are getting, we do not have any pork in it. I love that.
And So the vaccine itself, it cannot give you the flu. It's inactivated. It's a dead virus, effectively, that we're giving you. But if you've ever had a flu vaccine, you know that you can get a bit of a sore arm. Sometimes feel a bit achy for a few days, but believe me, it's nothing compared to having the flu. So these are expected, but you're not getting the flu from the vaccine. But one thing we do have to remember is at the same time as we're giving all these flu vaccines, there's lots of other coughs, colds and viruses that are circulating out there, and we can still catch all of them even if we've had the flu vaccine. Unfortunately, we don't have a vaccine against the cold virus as of yet.
Ouch. We should have. Richard, you should start working on that.
Yes, I'm in my little laboratory in my garden looking for that magic. Make some money. Could I just stress a couple of other things on that are important we don't cover? One is about antibiotics. Antibiotics do not work in flu. Flu's caused by a virus. So if you take an antibiotic for the flu itself, you will potentially get adverse side effects. You might get diarrhea. You might get thrush, which is an infection that affects generally moist areas of your body, and yet no benefit to killing the virus or making you better any sooner. And just two other ones. Vitamin C. People take vitamin C and they think that's going to protect them against the flu. That again is a myth. There's no evidence whatsoever that vitamin C will help you combat flu. And the other thing which Simon Stevens, our health minister, emphasised on the weekend.
Not for long. Not for long.
Not for long. Perhaps not for long. Was about homeopathic remedies. Homeopathic remedies are viewed by healthcare professionals as not. They don't work. So don't think that I've got flu, I'll take a homeopathic remedy instead of having a vaccine, because that will not protect you from the flu.
Indeed, and that is a really good point you just made, Richard. Because one of the things people do think that, as soon as I have flu vaccine, I normally get flu, and I hate that. Is that true? Because you don't used to have flu vaccine, and you start having flu vaccine.
Certainly, as Emily described, when you have flu vaccine, you might get some minor issues, and that could be injection where you might feel a bit sore, but also,
as Emily
said, but you can certainly, a lot of patients would get a little bit of achiness for a day or two afterwards, but that's it's as mild as that. And if it's very uncomfortable, they can take their paracetamol for those aches and pains. So, but
Naisha, being a flu lead in Luton CCG, do you take flu vaccinations?
Yeah, absolutely. I had mine 2 weeks ago. We had we actually had a flu clinic within the CCG just to make sure that we got all our staff vaccinated. So I was the second in the door.
So
Richard was first.
Oh, okay. You're following the boss.
Leading by example.
Exactly. You're following the boss. You're following the boss. Oh, at this moment, let me introduce our listeners as well. So, listeners, if you have any questions or queries regarding our show tonight, please give us a call on 01582 481822. I repeat, 01582 481822, or you can send your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. And on that note, I do have a question on my screen, which is really nice. Right, the question is from one of my listeners, and it goes, if my wife is pregnant, should I get a flu jab? And the second part of that question is, would I need to pay? So, Grace, you are the best person to answer this.
Am I? I think maybe Emily, about pain and where that can go.
So at the present time, we're advising all pregnant women themselves to have the flu vaccination. obviously, if the husband has got some underlying medical condition, then they can have their flu vaccine at their GP surgery or their pharmacy for free. Pharmacies do offer the flu vaccination for... it's a varying cost, but you can pay for a flu vaccination. And if you felt that was appropriate, then I would encourage you to do that. So that's the situation at present. The NHS, we've got fairly sort of strict criteria for who we vaccinate and who we don't. Although as I'm a nurse myself, and I do have I can make a clinical decision if I feel that it's appropriate. So it may be that gentleman needs to go and speak to his practice nurse with his wife.
So, to be honest, you should have said this, that you are a practice nurse in the beginning, just like these two guys and girls never said that they are clinical pharmacists as well as being a member of CCG. So at least it will have more weight on the back, saying that I just have clinicians in the room. But anyhow, thank you so much for that. And this is something which is sometimes do get...
Okay, I'll just tell you on the cost. Was this around £10?
Yeah.
It's around £10 for the cost of the vaccine, and you get from the pharmacy.
And on that note, Naisha, see, I forgot your name already. So in terms of the pharmacies, how can pharmacy help you if you want to get a flu vaccination, and if you're not sure whether you have flu or not?
Well, when it comes to those who are eligible for a flu vaccination with the NHS, as Emily mentioned, there are strict criteria. So if I just quickly mention the groups that are eligible, we mentioned the pregnant woman, we mentioned the super at-risk group, so that's your immunocompromised patients, your
chronic liver disease, neurological disease,
so your learning disability patients. And we mentioned the pregnant woman. In addition to those groups, there's also all those patients that are 65 years and over, all those patients with 6 months to 65 years with a clinical, within the clinical risk groups, people who are living in a residential or nursing home, people who are a main carer of an older person or a disabled person, and children aged 2 to 3, and all primary school age children up to year 6 are now eligible for a flu vaccine on the NHS. So it's good to...
Can I ask you to repeat that as well, please, again?
So you've got all your 65 years and over.
That's us to check.
Those aged 65 months to under 65 in clinical risk groups.
That's you check.
You've got your pregnant woman. It's not me. You've got those living in a residential or nursing home. That might be me. You've got the main carer of an older or disabled person, and children aged 2, from age 2 on the 31st of August 2019 up to primary school age, year 6. They're all eligible for vaccination, free flu vaccination within the national programme. And we're also encouraging frontline workers to also make sure that they're staff. So you've got people who work in health and social care. We're also encouraging that they get their vaccination as well to prevent them from getting the flu.
So when you say health and social care worker, that means anybody who works in GP surgeries, anybody who works in care homes, anybody who works in pharmacies as well, and if they are a carer of an elderly patient or a disabled person. Perfect. Okay. As you say, it's up till the school age of...
Up to year 6. So I think that's the
Emily,
2.
if I'm not mistaken, for the school programs, we still give flu vaccines in the school?
We do.
Yeah. All my kids have had them.
Yeah. We give the nasal flu spray to the children.
And in Luton, we are doing a pilot project as well. For at the moment, there are only 10 schools which has been taking part, which is 6 public and 4 private schools, Islamic schools, and they will be given...
They'll be given the injectable inactivated vaccine
because they do not have
because the Fluens, the nasal spray, has got this porcine gelatin, public health in this area. As a small pilot was started last year, and it has been widened this year. It was very, very successful, and we're very grateful for all the parents that participated in that, and we're encouraging all of the parents that are being offered this year their child to have the inactivated injection to please take it up, so that we can then increase this across the population.
Now, one of the things, I have another question right on my screen. One of the questions which, the question says, what about kids who are homeschooled? Are they getting flu vaccination?
Yes, and they get it through the same system as the school children in school. So the school age immunisation service, they cover homeschool children as well.
So,
and there are contact details, but I would have to I could follow that up with you.
Yeah, sure.
So yes, definitely, and they cover all of the school age immunisations, including flu.
Okay. On my screen, there's another question just popped up. What is Aussie flu?
Aussie flu is it's Australia, Australian. So the flu season starts earlier, or you could look at it starts later.
In their winter,
which end of the horse you're looking at? But and Aussie flu, year. I think was it last year or the year before when we had that quite virulent strain that came over
that
from...
was 2 years ago.
2 years ago, wasn't it? Yeah. And so everyone now thinks about Aussie flu. Aussie flu strain doesn't mean we're going to get the same strain. And this year it's altered slightly from what the Australians have encountered. And the flu strain that's coming over to the UK that we're seeing cases of at the moment is the vaccination that we have is very active against that. It's an excellent fit for the strain that's coming over. But Aussie flu is just flu as in Australia, but that doesn't mean we get the same flu strain coming to the UK. It modifies itself. The virus modifies itself.
Okay, and another question is very bit kind of a peculiarly strange. It says, why medication brands as flu and cold, and if they are different from the flu, means are they why it says
that's
cold and flu?
That's a pain, isn't it? Really, it's marketing. It's not what we would like how the marketing should happen. It's the. I don't know if you ever watch those films where you get in the Wild West when you get the person selling this magic elixir that cures everything, because you can get more sales if you've got something that will, can help with flu and with cold. So in those flu remedies, those cold remedies, I'm probably doing a disservice here actually a little bit to the manufacturers, because in those products, it primarily will have paracetamol. So paracetamol will help with the aches and the pains. It also brings the temperature down. Now, bringing the temperature down there is an argument that you would use the paracetamol to bring the temperature down where you've got perhaps in a child who's very, very restless and irritable. But when that restlessness and irritability goes, then you shouldn't really. It's not going to harm them, but it's better if you don't give the child the paracetamol when they lose that irritability, even though they might still have a slightly raised temperature, because the temperature does help to kill the virus there. So flu and cold remedies, they have a bit of paracetamol in for the temperature, and they might have a decongestant in, which will help, particularly in the cold
So basically, it has all the ingredients which can help you with the subsiding certain symptoms, rather than
it can help with
rather than preventing it.
It's not preventative.
Yeah.
It isn't a cure.
Yeah, it's not a cure. It doesn't prevent. And like Richard said, this for viral illnesses. Most times it's more of a supportive, to put the symptoms, alleviates the symptoms, but it's not preventing you from having the disease itself.
Okay.
Yeah.
Cool. When we talk about flu and its advertisement and pharmacies, so in terms of the pharmacy itself, do pharmacy help give flu vaccinations, and if does, or what do they literally promote it actively?
Yeah, they absolutely. Yeah, they are part of the national program. Most of the pharmacies are signed up to administer flu vaccines for people who are part of this, who will be eligible for a free flu vaccine.
And do they explain it that who are eligible and so forth?
Yeah, so they also, each patient, when they go into the community pharmacy, they also have to sign a form just confirming how they are eligible for this free flu vaccine. And this information, after the pharmacist will go through it with the patient, and they administer the flu vaccine, that information generally transmitted back to the patient's GP practice. So the GP will also know that this particular person has had their flu vaccine.
Okay. Okay. Will the pharmacy give... Oh, sorry, there's another question pop on my screen. Says, will pharmacy give flu jabs on the spot, or do I need to book an appointment? Naisha?
Yeah, they're generally quite good. Once they have available, once they're not too busy, I think they would probably make time.
You can just
to
go
be
in
honest.
there and they will give. Most of them will be able to give you a flu jab within 5 minutes or 10 minutes.
You shouldn't have to wait too long.
It's very, very efficient service.
Emily, in terms of the pregnant women, who advise pregnant women to get flu vaccines, and can they get it from anywhere or everywhere, or where they can get it from, if not just the GP surgeries?
I think that doctors, nurses, midwives generally agree that the flu vaccination for pregnant women is really important. And I know that at Public Health England that we are set up to help to protect the nation's health. We really want to promote the flu vaccination in pregnant women. This is what we're here today to really try to stress to everybody out there. Because it not only, as Grace has said, it not only protects the woman but the unborn child as well, and the baby in those first 6 months of life when they are so vulnerable, and you never know exactly what's going to happen at birth, and we don't have a vaccine to protect the child in those first 6 months. So that's why it is so important. So pregnant women are being offered the flu vaccine by midwives in the hospital, but they can equally go to their GP or to their pharmacy and have the vaccine. Nobody need worry. There's very few people that cannot have the flu vaccination, and the clinician that is going to give you the vaccine will check that you're not allergic to anything, or there's no reason why you shouldn't have the vaccine. So being pregnant in itself is a reason to have the vaccine, not to not have the vaccine. You see what I mean?
And with the vaccines, the pregnant women also have pertussis.
Yeah.
So when they go and have their pertussis, they can have their flu vaccine as well.
So if you are around the 20-week of pregnancy stage, we give you the whooping cough vaccination, and we can give you the flu at the same time. So if you are unfortunately not offered the flu vaccination, it may be worth just mentioning at that time
when you go for the whooping cough.
When you go for the whooping cough vaccine,
regardless whether you're outside the flu season.
Well, no. And the other thing I would like to say is it's if you are pregnant across, because you could effectively be pregnant across 2 flu seasons, you will need 2 flu vaccines, because we change the strains of them every year.
So if somebody being diagnosed as pregnant, not diagnosed, pregnant in February,
yes, you're right,
they may need it again in September.
Yes, they will indeed. And equally, if you have somebody that's had a flu vaccination perhaps in the Australian winter, they will still need one of our vaccinations, because they are very specific.
So that person is not
you
safe
can never have too many flu vaccinations.
Okay, and Grace, let me quickly capture these two because that's a bit kind of important one as well. Is there any? Are there any cases of flu in newborn infants, and what are the symptoms of flus in newborn infants?
Yeah, so we've had very few cases. There have been very reported cases of the flu infection in newborn infants. In these infants, they've been preterm. So that's again, if pregnant women do not get the vaccine and do get the flu infection, it can cause preterm. They can go into preterm labor. So we've had cases in very preterm, and it affects all. Like I said, it affects all the organs, and these babies sometimes end up they're very low birth weight. So we're talking about 500 grams here. So very tiny babies who have to stay in the intensive care unit for up to 4 months. So that's a long hospital stay.
And what are their symptoms?
They get so it affects the organs, so they get respiratory symptoms. So they end up needing support with their breathing. Some of them get ventilated for a long period of time. So it's mainly the breathing. They have feeding difficulties because they are preterm, and they will need a long-term feeding support. And then the general, they are more vulnerable to other infections, what we call sepsis. So they get infections, and they may end up needing a long-term treatment with antimicrobials and different other medicines like that. So it's really important that the unborn child gets protected, because as we've said, that protection can last for the first 6 months. And I just want to add that breastfeeding, if moms do get the vaccine and they breastfeed their infants, they continue to protect the babies as well during breastfeeding during that time.
If somebody just literally deliver the baby and the flu season starts, can they have the flu vaccine?
So they can't. Well, it says 2 weeks postpartum, so after delivery, they can still have it. Yeah.
Okay.
Yeah.
On this note, unfortunately, our time has passed, and the time has gone quickly.
Just quick. Not. You don't need to go to the GPs unless you're experiencing more severe symptoms, but you can dial. If you're worried, you can dial 111, and there will be a professional available to you and they will advise you whether you do need to go to your GP. But generally, most often you won't need to go. You don't need to go to your GP.
Perfect. Thank you so much all for coming to the show. Thank you so much, Richard, Naisha, Grace, and Emily. Thank you so much for the show. Until next week, I'm Fahad Matin, your host. Stay safe.
Thank you for listening to our podcast. We stream our daily broadcast on inspirefm.org. You'll find all our daily updates on our social media at InspireFM Luton.